there's lots of controversy about, labels in psychiatry or labels in mental health, but, diagnosis is an important thing. You can have problems, you can have many symptoms. Often human existence is full of, a variety of feelings and disturbing thoughts at times and so on, and those are not illnesses. But when something is persistent and pervasive and painful, the question is, does it constitute a symptom? And the best person to answer that is someone who's used to thinking about you or can think about you in the fullest way. A primary care physician is particularly well placed to do this because they can think about these symptoms both as being influenced by other health conditions. Maybe you have diabetes, maybe you've had high blood pressure, or maybe your symptoms match that of a hormonal problem or anemia. So the family doctor can hear your symptoms and try to investigate whether there are other physical health contributors to the symptoms that you have. And then, of course, they are trained to be able to identify depression, anxiety, PTSD, alcohol problems, and other kinds of mental disorders. So diagnosis is important in terms of ruling out other medical conditions. And then each mental health diagnosis actually has a number of defining characteristics: how many symptoms, how intense they are, how disabling they are, and whether they could be part of something else. And that's what doctors are trained to figure out. Now, other mental health professionals will certainly have some expertise in identifying the mental health disorder, but they won't necessarily have the full breadth of experience or training to make a definitive diagnosis. Psychologists, can certainly give you diagnoses, and they're more likely to use pen and paper tests or computerized tests to help with that. So that would be another valuable way to get information about your diagnosis. Psychiatrists, of course, are medical doctors, and so they can use their medical skills in thinking about other health contributors to your condition. But beyond that, they are the ultimate arbiters or decision makers about the presence or absence of a mental health disorder.